Dr. Jonathan Tripp is in great shape. That's why he can run down the hallway just as the music starts. He's right on cue. You see, that's a good thing. There's an old story about the honeymooners where Jackie Gleason missed his cue to come out on stage when the show was done live. So Art Carney sat down and improvised a whole routine where he peeled an orange that he took out of the icebox for 7 minutes and had the audience in stitches. But the orange was good for his health. We should point out,
That's right. Back
prom-
to back to better health.
promoting
That's it.
vitamin C. So you've got a lot to talk about today.
I do. In fact, kind of what's ailing you, kind of a topic, because I have a topic that's really about things we usually don't know about ourselves if we have it.
Really,
Yeah, and so
a
a
little
lot of
ticking
people.
time bomb sometimes.
It is. In this case, can be as serious as causing heart attacks and strokes and heart failure and things that are pretty threatening. So, as we talk about this topic, I want the listeners to realize that if you have this, you probably don't know it. But if somebody lives with you and especially sleeps with you, they probably could figure it out and help the doctor diagnose it for you and get you out of trouble. So, the topic is sleep apnea.
Yeah,
It's what's bringing you down.
I had when mine was first diagnosed, it was done because you know somebody sleeping in another room thought they heard me. Just I'd make some noise, and then they came in and actually put their hand by my face. And so it was a family member, and at that point, I went to the sleep center, and holy smokes,
It was pretty obvious, huh?
yeah, it was
Yeah.
pretty
I
obvious.
mean, to everybody outside of you.
Well, of course, you don't know when you're sleeping, obviously.
Yeah. No, in fact, this is the thing is sleep apnea is intermittent stopping of breathing. So you actually quit breathing. Sometimes it's as brief as, 10 seconds, but often I've seen in some of the reports I get back on sleep studies, they're not breathing for a full minute, sometimes a minute and a half, and then they take a breath. That's a long time if you've ever been underwater for a minute. That's a long time to hold your breath. And this is happening in severe cases, about every 5 minutes. So out of every 5 minutes, you're not breathing for one of them. That's not great for sleep because your brain won't allow you to stay in deep sleep because it's screaming for oxygen and wakes you up enough that you actually take a big breath and then you start to fall back into deeper sleep and stop breathing again.
Mostly, it's also associated with a lot of snoring, right?
Frequently it is, not always, but a lot of times the snoring. In fact, I can use my dad as an example because he can't sue me. But his snoring. In fact, great story. I gotta just tell this. We knew my dad snored, but we took a trip in a motorhome. I was newly married, and so we had three couples and one small child in this motorhome. So my parents, my brother and his wife, and their child, and then my wife and myself. And you know, it didn't matter where you were. The motorhome was not big enough to not be rocked all night by Dad snoring. But the deal is he would actually stop breathing, and none of us really got what that meant at the time because I obviously wasn't a doctor. But um, it was later in my residency that I was home for one Christmas, sitting watching TV next to the wall where his bedroom was, and I could hear him snoring. And my brain just picked up on this pattern that he would snore loudly, then softer, 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 pause, 10, 15, 20 seconds. Great big breath, big snore. So many of you probably heard that kind of a pattern in someone that you live with or know. And that is classic severe sleep apnea. So he never would get good sleep. Was, you know, we were trying to diagnose him with depression or all kinds of things, but he says, I don't really feel depressed. I just don't feel right. I don't feel good. I don't feel rested. And finally, when we figured this out, he only tolerated a mask from a CPAP, which is the main machine used to uh, treat sleep apnea. And he says, in 3 hours of being on that machine, I felt 10 years younger the next morning. So even a little bit of oxygen goes a long way in some. But it's not that big of a miracle for everyone. So we need to talk about some of the bigger reasons why we want to know about this. And so the what's the big, bad, and the ugly? That's what I'd call it. And it causes high blood pressure. So if you have high blood pressure and you get checked for sleep apnea, you might be able to reduce that blood pressure without being on medicine. That's a big advantage. I like no medicine. Uh, risk of stroke, heart failure. Heart failure is when your pump isn't strong enough to push the blood through, and so it starts to back up fluid in your lungs and in your legs. Irregular heartbeats, like um, atrial fibrillation, is a circumstance disease. It is a disease. It's a condition that your heart beats very irregularly, and it will cause you trouble with being able to do physical exercise because you get lightheaded. You sometimes some people feel it, some don't. They can feel irregular pounding in their chest, but the lightheadedness, the dizziness, feeling of weakness is what goes along with that. And sleep apnea is a big cause of that. In fact, that's actually what my dad probably died of is atrial fibrillation, probably caused by sleep apnea and heart attacks.
Hold on to those thoughts. We've got more coming up with Dr. Jonathan Tripp from Tripp Family Medicine. Right here in Twin Falls, Idaho, we should point out, too, as well. The doctor is talking sleep apnea today and some of the side effects and what you may need to know. Also, you can give us a telephone call if you've got a question or comment on the topic. Coming up in just a few minutes at 736-0300, 736-0300 at 840. It's 18. Dr. Jonathan Tripp in studio with us this morning. Better Health with Tripp Family Medicine. Bill Colley answering the telephones. And it's 8:43. We've got 17. If you've got a comment or question for the doctor, we're talking sleep apnea today and some of the serious health hazards you could have from that. And you may not even know that most people never know they're suffering from it until it actually gets diagnosed. Telephone number 736-0300, 736-0300. You, as you mentioned, you were talking it could hasten death. I mean, this
Yeah,
is not just a lot of uh,
not just being
secondary health
tired.
issues. It
Yep.
could be quite serious.
Yeah, it's hard to believe because it's unknown to the person who has it. So they really struggle with the idea of, well, I'm a little tired, but I'm getting older, or I worked really hard this week, and that's, so what if I snore? Even if they know that they snore, because a lot of people don't even know they snore. In fact, you ask somebody and they'll say, "Well, my spouse knows." They say I do, but I don't know if I do. So sleep apnea is very similar. People say, "Well, wouldn't I wake up and know that I woke up because I was short of breath?" Most never know that they're short of breath. They'll wake up sometimes fully enough that they are aware they're awake. And so they kind of say, well, I guess I got to go to the bathroom. So they get up, 3 or 4 times a night and assume, well, if you're a guy, oh, it must be my prostate. And if you're a woman, it's, well, I guess I just don't have the bladder control I used to have. But a lot of times it has nothing to do with the urinary tract. It's all truly in your lungs and in your brain saying, let's get up. We're not breathing well on this. And so, what does it sound or look like? We talked about the pause in the breathing. You talked about somebody putting their hand near your face. Well, what they were trying to do is see if there's any airflow. Because often when somebody has actually stopped breathing, it's not that their chest doesn't move. Their chest is still trying to pull air in, but the throat has kind of fallen down or closed off the airway as you relax and you sleep. And especially laying on your back seems to really, bring this out. So your throat is acting like a valve and the air can't get in and out. And so that's like being underwater, and your brain says, let's go to the surface, and it does bring you up. And often you never wake up, but you never stay in the deeper REM sleep that's pretty required for feeling like you've rested. So one of the questions is, are you sleepy during the day? Or when you wake up, do you really feel rested? Do you feel like you've had, 6 or 8 hours of sleep? Or do you feel like, geez, I feel about the same as when I went to bed, and it depends on how hard you've been working. You can reason it away, but if it's pretty much every day, that's a big hint that there's something else going on. So let's talk about who gets it. Who gets sleep apnea? Is it just the old 40-year-olds like my father was that would fall asleep at the wheel when he's driving anywhere in the middle of the afternoon? And I thought as a kid that just must be what those old people do when they turn 40. So now that I'm almost 40, that's a little bit of a lie. Um, I don't fall asleep at the wheel, and I usually feel rested when I wake up. But if I have sleep apnea, I probably don't know it. And so I'm putting myself in the same Basket is everyone I'm talking to. So who gets it? Anyone, even children. We usually think of adults, we think of guys, we think overweight. Those are true, those are risk factors. But even having diabetes or being a smoker is a risk factor. You know, you can be a skinny guy or lady and still have sleep apnea. So one of the biggest hints is, do you snore? Because if you do, that's a hint that you're at least a setup for it. Kiddos that have chronic nasal congestion, or even adults, but especially a kiddo that has a narrow airway and they're a noisy breather when they sleep, they may actually have sleep apnea, and that's something that's worth checking out.
When they're
As
young.
yeah, yeah, as a 5, 6, 10 year old. I have a son that in hindsight, I probably should have had checked out, or at a minimum had his tonsils out a lot earlier. He had them out when he's 13, but we were chronically fighting this nasal congestion and noisy breathing, and in hindsight, he was a setup for sleep apnea. So
CPAP seems to be the most regular approach to all of this, but are there other things that work?
there are, shall we say, what people think of as less invasive. There are some. They're like a mouth guard that forces your bottom jaw to go forward. That tends to keep that valve type action of your neck from happening as much. And that works for some people, but I would say the vast majority, if they have sleep apnea, the mouth guard doesn't seem to improve their sleep, uh, their symptoms much. But I'm not saying it's not worth a try, although mouth guards are not inexpensive. The guards we're talking about are not your football guard that you can buy for $10 or $20. This is usually $1,000 to $2,500 mouth guard to try. And the interesting part to me is the more definitive care is the CPAP. And even if you're paying cash out of pocket, you can probably buy a CPAP machine for 1,000 to 1,500. So if you say, well, I just don't really want to live with a machine, well, look at the cost, and you might find out that that machine is cheaper than the mouth guard.
And my experience is health insurance. Those of us who deal with like a Blue Cross type policy covers a lot of that cost, and then eventually you just own the machine outright. But they pick up on the monthly payments. They
Y-
pick up a share of it.
Yeah, health insurance is most of the time pretty good at helping or completely paying for CPAP and its related. Uh, there's like the mask and the tubing and things like that that goes with it. Probably the biggest hurdle for people is the thought of putting something on their face and sleeping with it. I could never get used to that, or at least that's what people say. But like my father, who was actually claustrophobic, so putting something on his face was a very serious threat. Uh, Finding out that even after 3 hours of tolerating it, that he felt so much better was a motivator for him to keep trying. And so about once a week for the next 6 weeks, he was trying different masks, and he would call me and say, I don't think I can do this. And I'd say, Dad, you already know you got to do this because it's killing you. And so we had those pep talks about once a week. And finally, at about 6 weeks, he had a device called nasal pillows, which is kind of like an inflatable piece of plastic on the end of tubes that goes up your nose. So it didn't cover his face, made all the difference in the world, kept his airway open, and I think really kind of changed his life for the rest of his life. And that's why he can't sue me because he did die.
But I'll point out too as well. In my experience is because you have the little water
Yeah,
container that goes in the machine, and
it's
you
a
put a little vinegar in there too, white vinegar, which is what I do to kind of keep it clean.
okay.
But
That's
that moisture in the air keeps that airway open while it's blowing too as well.
absolutely no, having dry air really dries you out. I mean, if you're not a mouth breather and you've ever had a clogged nose and had to breathe through your mouth, and you wake up with your tongue feeling like leather, that's what that humidifier helps avoid, so you don't feel like you've been dried out all night, and you slept well.
Right, right. You get up in the morning and you're going to feel that bit of extra refreshment.
So let's talk about what are the symptoms. We talk about daytime sleepiness. We have a little form that we use that just talks about like what's the likelihood that you might fall asleep sitting watching TV, or can't remember all the details, but especially like driving. And I think of mid afternoon where the sun's out and the car's warm. What's the chances that you need to kind of take a break from driving after a half hour, an hour? That's a big hint. Abrupt awakening. So especially if you're gasping or choking, most people don't get this, but if you do, That's a great time to say, let's go see the doc. Morning headaches. We get tension headaches that usually creep up over the day in the afternoon, and they get worse that way. But if you are waking up with a headache, that's a big hint that you've been running low on oxygen. So that's it's not the only cause of a morning headache, but that's a good thing to look at sleep apnea. Difficulty concentrating during the day. How many of us would like a better focus? You know, there's all kinds of supplements out there that tell us it'll help our brain power and our focus. There's nothing better than oxygen. So I mean, I'm okay with supplements, but if you're lacking oxygen, I don't care how many pills you take. Um, Experiencing mood changes, depression, irritability, edginess, you know, things that you feel like I react more strongly than I think I should. Um, High blood pressure, nighttime sweating, and this one will motivate some people to look at CPAP is decreased libido. So, you know, my sex drive is just not like what it was. Am I just getting older? Well, you know, if you're 92, we can talk about that. But, you know, if you're 45, we probably ought to talk about other possibilities. So those are probably anybody that's had an observed apneic episode. In other words, observed somebody else has observed you stop breathing while you're sleeping. Get it checked out. That is the single best evidence I have to say you already have it without having done the test yet.
Dr. Jonathan Tripp in studio with us this morning. It's 8:53, and we've got 16. Bill Colley with you as well. And the telephone number 7360300. The program is called Better Health with Tripp Family Medicine. And of course, the doctor likes to remind you life's too short not to feel good.
Yep.
For people who'd like to contact you at the office, there's a number of ways to do that.
Sure. We obviously still answer our telephones with a
Yes.
live
Good
person,
start.
not a phone tree, and you won't have to select from 14 options to finally get to a live voice. Not that I've ever been frustrated with that. But our phone number is 208 933 4400. And if we don't answer the phone, it's because there's already a bunch of other people calling. So don't give up. We definitely we'll take your call and get you taken care of. So 933 4400. On the web, we're at trippfamilymedicine.com. We have a new website that we're continuing to grow and develop and has some nice links of information, but also if you want to be a new patient, the new patient paperwork is there that you can print off and fill out and have all done so you don't spend 15 or 20 minutes in the office when your first appointment is. Um, and then Tripp Family Medicine on Facebook is another way to reach us. So happy to do that.
And we wanted to point out, talking about sleep apnea today, the thing is that regulation of the brain that goes on in sleep, it has so many other offshoots. Because I know that when I was talking to the doctors about it, when I first went through all the testing, they explained to me it can have it can impact weight control, it can impact testosterone production. There was any number of things they explained to me could be, that are secondarily impacted by all of this.
Yeah, if you think of how your brain, not just the brain that we think with, but our pituitary gland, hypothalamus, areas that are in the brain that regulate everything else in our body, hormones from your thyroid to, like you said, testosterone, all of those things are affected when the brain's not functioning well. Uh, it's so, we think about you don't do well if you don't have any blood. Well, why is that? Well, because the blood is taking care of all the combinations of interactions in your body, but one of the biggest things is it's carrying oxygen everywhere. And so if you don't have oxygen, which is what sleep apnea does to you, things are going to get messed up. And, your body is built to work and live through tough times, and sleep apnea is a tough time. And so I have many high functioning people. So this is kind of like if you say, well, I didn't think, George was an alcoholic because he wasn't lying in the gutter. They're a functional alcoholic. We have most people are very functional with sleep apnea, but they're heading towards an earlier death than necessary and a poorer quality of life along the way. That if you can identify this and get it treated, whether it's through weight loss or whether it's through using a CPAP, you're going to live better and live longer. And the other side I was trying to get to is if you want to lose weight and you say, I don't want to be on a machine, I want to lose weight, your motivation, your ability to lose weight actually increases while you're on CPAP. And so a lot of that I think has to do with your mood and your energy level.
Got about 45 seconds to go. Is there also a surgical option?
There are surgical options. This would be more extreme cases. There used to be a real popular surgery of the throat where the little dangly in the back of your throat called the uvula. They would cut that out and a part of the soft tissue, the soft palate above that. And what they found is after about 2 years, you were right back to the beginning point. And so you had a surgery that changed your throat, hurt, and only bought you about 2 years. So that's probably not the most recommended, but if CPAP is not enough, we're going to need to talk to probably an ear, nose, and throat surgeon to figure out what can we do rather than just let you, ride off into the sunset.
Once more, what is the telephone number at the office for people who are tuning in this morning?
You betcha. 208 933 4400. And something you don't hear about much from me here is we do cosmetic stuff. We're just barely telling the public about it. So if you want Botox before Christmas, give our office a call. We're doing it this week.
You look really good in the family photos.
That's right.
Or when you're sitting with Santa Claus. Yeah.
And that's coming from a doctor with 10 years of experience with Botox and fillers. This is not a new game for me. So
Experience counts.
it does.
We want to point out one more hour coming up of Top Story with Bill Colley. We want to thank Dr. Jonathan Tripp for joining us. We'll see him again next week between 8:30 and 9 o'clock. Better Health with Tripp Family Medicine. And, of course, remember, life's too short not to feel good. Got a couple of things we'll share coming up in the next hour. Looks like those folks who are protesting in North Dakota about the pipeline issue, a lot of them could end up as popsicles if they don't take care of their own health fairly soon. Details on the way.